Hey, y'all. Welcome to Questions You Didn't Ask. Did you know that this very spot could be showcasing your business or event? Whether it's an audio ad on our podcast or a visual ad on our new YouTube station, or even both, we've got the space for you. Niasha Fray Consulting is reaching a growing audience of over 1,000 leaders who are passionate about health equity, social justice, and civil rights activism. These are professionals just like you, working across higher education, research, healthcare, nonprofit, government, and even public health sectors. If you're ready to get your message in front of a dedicated and engaged audience, send me an email at niashafrayconsultingllc@gmail.com. Let's talk about how we can help you connect with the people who need to hear about your services and products that advance health equity and wellness. Don't miss out. Get in the mix and let's make an impact together. So far this season, we've been talking to moms who advocate for individuals with disabilities and behavioral health challenges. We've also covered the unique sexual and reproductive health needs for women over 40. Now we're taking a deeper dive into a crucial issue related to women's health equity, maternal and infant health equity. As you know, I love going on these intellectual and experiential journeys with you. But before we get into today's topic, I want to set the stage with some key terms that are essential to understanding maternal health challenges. These terms might not at all come up during today's episode, but they will help provide context for what's at stake when we talk about maternal and infant health. Let's start with the pregnancy related mortality ratio, abbreviated PRMR. This ratio estimates the number of pregnancy related deaths per 100,000 live births. Essentially, for every 100,000 babies born, this ratio tells us how many mothers lose their lives during or shortly after childbirth. It's a painful statistic that shows how dangerous pregnancy can be for some women. Another term that may come up is pregnancy related deaths, which tracks deaths within a year of pregnancy. Yes, that means we start counting as soon as the pregnancy begins, not just after the baby is born. The maternal mortality rate is also key. You've likely heard this term in the news, and we touched on it in season 2, series 2, titled I Called Out, But They Didn't Hear Me, where we explored the harrowing experiences of Dr. Marianne Farrow. She was not just a patient, but a lead physician in the very hospital where she gave birth. And even her colleagues ignored her cries for help during her traumatic delivery. Despite her medical expertise and knowledge of her own body, it wasn't until she escalated her calls for help to higher level administrators and physicians that anyone intervened. Her story is a powerful reminder of how crucial it is to listen to Black women when they advocate for themselves. Next is infant mortality, which represents the number of babies who die before their first birthday compared to every 1,000 live births. This statistic explains why many parents go all out for that first birthday. It's not just a milestone, it's a survival story. Some parents may seem over the top in their celebrations, but the truth is that this is a big deal, especially when you consider how fragile life can be in that first year. We also need to talk about fetal deaths or stillbirths, which refer to pregnancy loss after 20 weeks. This is one of the most heartbreaking topics, and it's something many parents never talk about, even though it's more common than people think. It's important to know that in many cases, doctors and scientists don't have clear answers as to why stillbirths happen. That's why organizations like the March of Dimes put so much effort into research to find answers and hopefully prevent these tragedies. But even with all the science in the world, sometimes there's just nothing a mother or parent can do to prevent it. Now, let's dig into the disparities in maternal and infant health, particularly for Black women. A 2023 Kaiser Family Foundation report found that Black women are over 3 times more likely to die from pregnancy related causes compared to white women. This statistic is beyond alarming and points to a serious issue in the healthcare system. One of the primary causes of these deaths is cardiovascular disease, and the lack of adequate prenatal and postnatal care only exacerbates the problem. In fact, Black women are almost twice as likely as white women to have late or no prenatal care at all. Beyond maternal deaths, we see a stark difference in infant health outcomes. Black infants are over twice as likely to die before their first birthday compared to white infants. The leading causes of infant mortality include birth defects, preterm birth, low birth weight, and complications during pregnancy. But what's behind these disparities? One explanation is the weathering hypothesis, which suggests that the cumulative effects of racism and stress take a toll on Black women's health over time. The constant exposure to these stressors wears down their bodies, leading to poorer health outcomes. Connected to the weathering hypothesis is the concept of allostatic load. This term refers to the physiological wear and tear that results from chronic stress over time. Over time, this stress overloads the body's systems, increasing vulnerability to illness and making pregnancy riskier for Black women. The weathering hypothesis and allostatic load provide a framework for understanding why Black women, regardless of their income or education, often face worse health outcomes than their white counterparts. In season 2, series 2, we touched on societal stressors that impact Black women's health, from economic disparities to daily encounters with racism, and the cumulative impact of these stressors is real and measurable. To give you a concrete example, a 2023 Johns Hopkins study cited research showing that the wealthiest Black women in California face a higher risk of maternal mortality than the least wealthy white women. Income alone doesn't explain these outcomes. Racism and discrimination do. It's not just about individual health. This is a community issue, a family issue, and yes, even a men's health issue. When a mother dies, it impacts fathers, partners, and children too. Maternal health is family health, and family health is community health. Whew, take a deep breath with me. I know this is heavy, but it's essential that we understand the depth of these issues if we want to create real change. Maternal and infant health equity isn't just about healthcare. It's about addressing societal structures, supporting mothers and families, and making sure that our systems don't fail the most vulnerable. And with that, I'm excited to get into today's conversation. You're in for a rich, informative discussion about maternal and infant health equity that will open your eyes to the real challenges and hopefully inspire action. Let's get into the heart of the matter with our guests, Melba Perry and Jessica Burris. Melba Perry is a dedicated community-based doula with a heartfelt passion for offering comprehensive support to individuals and families. Her mission is to ensure that you receive not only the medical care you need, but also the compassionate guidance and understanding that can truly make a difference during this challenging time. Melba's approach to doula care is rooted in a holistic perspective. She also enjoys assisting families that are embarking on the journey of high-risk pregnancies affected by genetic disorders, as she has personal experiences with a high-risk pregnancy. Beyond the clinical aspects, she provides emotional support, companionship, and an open heart to listen. She understands that each aspect of your journey is interconnected, and she's committed to nurturing your overall well being. Melba firmly believes in the strength of the community. Through a network of support, Melba connects you with local resources, support groups, and organizations that can enhance your journey. You are not alone on this path, and together, Melba will assist in building a network that uplifts and empowers you. As your doula, Melba is dedicated to helping you make informed decisions that align with your values, beliefs, and desires. She also offers educational sessions that help demystify genetic disorders and high risk pregnancies, empowering you to understand your situation more deeply. Jessica Burris is a passionate advocate dedicated to improving Black maternal health, with a particular focus on enhancing the care, support, and resources available to Black mothers, especially regarding breastfeeding. At 44 years old, Jessica is not only a wife and mother of three, but also a former breastfeeding counselor who draws from both her professional and personal experience to fuel her advocacy. Having witnessed firsthand the challenges that Black mothers face, from inadequate healthcare access to societal barriers that discourage breastfeeding, Jessica is committed to driving change. She supports programs that provide education and resources to empower Black mothers to make informed decisions about their health and their babies. Through her work, Jessica is helping to build a stronger, healthier future for families and communities. Thank you so much, ladies, for joining me. So, we're going to jump right into this conversation with our first question. And that is a little bit of a selfish question, but a good question nonetheless for our audience. Tell me, Melba and Jessica, why did you decide to come on Questions You Didn't Ask to discuss maternal health equity and related topics?
So for me, just the title itself, Questions We Didn't Ask. There's so many questions that we didn't ask because we didn't know to ask them. Mm-hmm. And that I wanted to just put out there, here are some questions to think about to ask. And if you don't know that certain things are available, you won't know to ask for it. So that's basically my reason to wanting to be a part of the show.
Jessica, what stood out to you when I reached out and asked for you to join me today on Questions You Didn't Ask to discuss maternal health equity and related topics?
Well, I knew when I met you for the first time almost a year ago, and I learned about what, you did for your profession and the different topics you talk about, especially relating to Black women. Black maternal health is something I've never given a lot of thought about when it comes specifically to Black women. But the older I've gotten, I'm 44 now, I have friends and family that I've witnessed go through certain things and not receiving the care that they should or the answers that they need. And I'm looking it up on Google, Dr. Google, just do this, do that, but they're not getting the same feedback from their doctors. But also I had my last two kids at 35 and 37. Mm-hmm. And I already knew I wanted to breastfeed. I knew about breastfeeding. But what I didn't know until I became a counselor is how breastfeeding is so important to not just the baby, but to the recovery of the mother postpartum. And that really fascinated me. And that, just knowing that and seeing how that education wasn't provided across the board, especially to, Black women, it blew my mind, and it made me want to just dive in and find all the ways that I could support and be a part of making that better.
Yeah. Well, I appreciate you both for answering the call. I can share that, we met at a time when we were trying to connect as mothers, right? And trying to get some respite from mothering and being able to learn more about how to take care of ourselves, how to take care of our families. And in that space, we were surrounded by women that came from all different types of backgrounds and walks of life. And we recognize that maternal health, breastfeeding, high-risk pregnancy, genetic disorders, and a variety of other things are common to, concerns about that are common to so many different women. But in our space in our time, we really got a chance to kind of dive into our shared identity, right? As women of color, women of African or African American ancestry, and recognizing that as much as we relate to all of the women that were at that retreat, there were certain unique experiences that we had that were different. And so while we have this discussion, we're going to talk about maternal health and breastfeeding as it relates to a broad population, right? And what women need to know in general. But we'll pay a little bit more close attention to our Black and African American sisters because we know all too well about these personal stories of people not getting what they need and being able to witness health inequities, being able to witness health disparities, and recognizing that women of all ethnicities, right, deserve the best care possible. But when you see that women in general are struggling to get that care, and then Black women in particular are especially struggling, it kind of pulls us in because we can relate to these women. And I think that, that's really important in terms of what motivates us to have these discussions, is that if there's things that we have learned on our journey that we can pass on to help the next person and the next healthcare system and the next health policy and the next, administration, then let us do that. We're not here to just make an impact in one space, but we're hoping that our voice and what we've learned from other women can be used in a number of different spaces that can drive change. If you're enjoying the show as much as we love creating it, consider showing your support by buying us a cup of coffee. Visit buymeacoffee.com/Niasha Fray O. That's buymeacoffee.com/Niasha Fray O. All one word. Each cup is just $5, and every single one helps us continue to produce, develop, and sustain the high quality content you've come to expect from Questions You Didn't Ask. Thank you for your continued support, and let's keep the conversation going. So, Melba, I introduced you as the doula of our trio. And so, can you explain what a doula is and what motivated you to become one?
So, and I'm sorry, you might hear my kids in the background because my daughter's
That's
getting a little
perfect.
antsy. So, a doula is a non-medical support person that helps mom, when they are preparing for labor, birth, and postpartum, and more so help them advocate through the healthcare system. African Americans, our maternal mortality is 3 to 4 times higher than our counterparts. We have a higher risk of having premature labor. We have a higher risk of C-sections. And there's things that we can ask for that we don't know that we can ask for. And I myself, as a now doula and educated on the health system, and I've been working as a medical assistant for 20 plus years, didn't realize some of the stuff that a mom can ask for during that prenatal care and labor. So, helping them navigate through that is very important to me, especially the way statistics are. The recent March of Dimes report came out. They were hoping we will get a better grade, but here in North Carolina, we actually got a worse grade. We're a D plus. And North Carolina is not a huge state. So to say you're a D plus in comparison to other larger states says a lot right there on its own. One of the things that brought me into this is back in 2020, my son, we lost him to a car accident. He was hit by a car, and it was like, okay, I have the 2 other kids that I have to live for, and I had to find something to refocus on, and that's going to bring life into me. And what better way to help bring life back into myself is help other moms bring life into this world. And so for me, it's like, you know what? I always wanted to go to be a midwife, and I'm like, okay, I'm 44, almost 45 years old. I'm not about to go to nobody's nursing school right now. What's the best way for me to get this going? And so that's what I did. And my grandmother was a town midwife back home in Jamaica. So she helped actually deliver babies within the town of Jamaica. And some of those babies were her own grandchildren. She delivered one of my sisters and several of my cousins. So it's kind of like in the genes almost. I couldn't run away. You only can run away from your calling for but so long.
There you go. And you were inching toward it. Anyway, do you mind sharing with our audience a little bit more about your academic training and your professional training, and how, what did you have to do to become a doula? Because you were a lot of different things.
I am. So I did my initial training during COVID. Everything was available online. So I paid for training through an organization called Maternity Wives. And so I did that training, and I'm like, okay, here we go. I'm going to start this up. And I did it and started doing birth. And then I came across UNC had a project called A Cure for Moms that was just getting ready to get started. So I signed up to be a part of that project and did some community-based training with them to be more on the community-based side as well. And so things happened. I was not in a good space mentally at that time when it was time to start the project and do the doula portion of the project. And for me, it was very important that I'm in a good mental space when I'm helping these moms transition their baby into the world. You don't want any type of energy that's not good to be in a space like that. That's so sacred, in my opinion. So I stepped back from the doula portion of the project and started working on some training and recruitment. And then I did another training with DONA through a project with ECU. And so now I'm working, with them on some stuff as far as doula training. So I did several types of training as a doula, and then to become a doula. And then I also have a background of being a medical assistant. So, which helped out a lot in this journey, because I do have some sense of what's going on in the medical field and in the healthcare system in that space.
And it sounds like you have a lot of experience working with 2 major healthcare systems, UNC Health and then ECU.
Yes, that is true. So it's a lot, but to me, it's all worth it. No matter how many more trainings I have to go through, I'm going to do it. So
yeah, what keeps you committed to this work, Melba? And then I'm going to turn to you, Jessica, with another question.
Oh, what keeps me committed is seeing the numbers not going in the right direction. Once I see those numbers going in the right direction, I'll be like, okay, I can breathe now. But I still would not stop. I would want to say, okay, now they see why it's important to have a doula within the healthcare system. Now moms see why it's important to have a doula in the room. Now dads see, now grandma see, like now everyone see that doulas are not an accessory. It's necessary. People think, oh, you got a doula. What you got a doula for? You done had 4 or 5 kids. Yeah. But how many of those births was traumatic? And how many of those births could have been more beautiful births if you would have had a doula? So I don't, just my drive is to keep going until everyone accepts doulas, until the healthcare systems and insurance companies start paying for doulas. That's the goal, because the people that actually need the doulas can't really afford doulas. And that's my problem.
Right. Because we're talking about, Black women, we're talking about women in the South, and oftentimes, we know in general, most people don't have enough insurance to go around. Right. And so that is a problem. Even if you're insured, you might not have enough insurance. And then for those who are not insured, there's definitely not enough coverage to help them get the comprehensive health care and the holistic health care that you advocate so valiantly for. So, Jessica, I want to talk with you a little bit about your journey. I see in your bio that, you're a former breastfeeding counselor. And I remember from our conversation, you mentioned something about peer support. Can you tell us more about your experience in that role and how you got there?
Okay, so I worked as a breastfeeding peer counselor with my local WIC office, and I knew I was a mom on the program when I started when I had my daughter. I was approached in the hospital. Well, no, it was with my son actually, but they're 2 years apart. But a peer counselor it's just like, it's kind of like a doula, like it's non-medical. So you have guidelines of how much you can talk to a mom about breastfeeding counseling. The moms have to sign up for the program, because they can sign up after birth or before birth, but we just provide counseling, like breastfeeding counseling. So there's certain things I can't say, even though I might know as an experienced breastfeeding mom, and then I have to refer to the in-house IBCLC, or did I say that right? Is that IBCLC?
Yeah, you said it right.
Because you're one, right, Melba?
No, I was in the process of doing it through a Pathway 3 program. So I stopped, and now I'm on the COC track. So yeah.
Okay, I remember talking about that. But anyway, so
so what is that? Because I have no idea what you're talking about. And I'm sure some of our listeners don't.
That's like the highest level of being able to give the highest level for breastfeeding support. They can get hired, in hospitals, and Melba might know more, but it is the highest level, right?
Yes. So there are a internationally board certified lactation counselor or consultants. Yes. And they can have their own practice or be hired through the hospitals, and they can bill insurance companies as well. And COCs is just like a certified lactation counselor. Some insurances pay for them, like TRICARE and stuff like that. But as far the difference is, COCs cannot diagnose tongue ties, lip ties, and stuff like that. So they might see, oh, it looks like your baby have a tongue tie or a lip tie. I need to refer you to an IBCLC to have a more comprehensive exam, per se.
Okay. Yeah, when I was a peer counselor, that's when I learned about both of those. And I was fascinated. And right away, I wanted to be an IBCLC. But when I saw the training that was needed, not that I couldn't do it, but I had 2 kids, one with a disability. There was no way I was going to, but the CLC one was just as good. So that's that's still one of my goals. But anyway, the peer counselor, I worked at so it was the local health department, low-income moms, pretty much 100% of the moms were Medicaid moms, a majority women of color, Black moms, young moms, first-time moms. And so the way WIC works now, back in the day when WIC you just used to go in. I don't know if y'all were, I was a WIC child, and so I know.
I was a WIC mom.
Okay.
I was a WIC mom too.
So whenever you
Yeah,
guys,
lived experience.
well, when I had my first child as a teen mom, as a WIC, I would go into the health department and all you would see is like advertisements for formula. No one ever talked to me about breastfeeding. I just knew I was going to breastfeed because of my mom. And so I didn't have to have anyone talk to me. But I think I was probably a unique situation in 1995 with that as a 15-year-old. But now there is the World Health Organization they are successful in preventing the commercialization of or advertising of formula. So you don't see formula commercials a lot. You don't see any advertisements in your health department or WIC office for formula. Now they still provide it, but they don't start there. They always start with breastfeeding, which I was very impressed with. My role was very limited, and it was hard because I was so experienced with breastfeeding. So when I wanted to go that extra step, I knew I couldn't. Like I had to refer to someone higher. But I also learned so much because I had to do training. I thought I knew everything about breastfeeding. I didn't know half of stuff about breastfeeding just because it was easy for me. I didn't know, everything. And that's what made me really start to look at the people who do need extra support and education. It's not that I'm not saying anything bad about, WIC or the health department because they are state funded. So they only can go so far with the money they have. But just actually, it was really on like the back end, like the where it starts at in the hospital or the pediatrician's office or the gynecologist's office or even at home, just the lack of education, the lack of support. And when you have a young mom, a mom who comes from maybe, low income, single mom, they already are insecure about their ability to feed their baby. So there was just a lot of things that they just needed so much more education and support. And that was where, if I ever do become a certified lactation counselor,
when I become,
you're right. Thank you so much. That's going to be my focus is moms of color, Black moms and low income moms.
Thank you for joining us on Questions You Didn't Ask with me, Niasha Fray, and my guests, Melba Perry and Jessica Burris. Tune in next week as we continue our series From Birth to Beyond, unveiling challenges of maternal and infant health.